So let's call the meeting of the Gloucester Board of Health to order. It is Thursday, June 6th, roughly 5:30 in the evening. We're at the Rose Baker Senior Center in the second floor conference room. And this is a hybrid meeting. The public is welcome to attend this meeting in person, and a Zoom link is also available. Please note.
Oh, sorry. Okay, sorry.
That's good. Is it okay?
Yes.
Please note that the in-person meeting will not be suspended or terminated if technological problems interrupt the remote connection. The exception of the current problem. First order of business, let's go around the table and everyone on the staff and board introduce themselves, please.
Cindy Junker, Public Health Nurse.
Dominique Curley, Director of Public Health.
Marco Pellizzolo, board member.
Erin George, Board Member.
Joe Rosa, Chair of the Board.
Eric Kaplan, vice chair.
Bree Turco, Senior Health Inspector.
Gabrielle White, Assistant Health Director. Leslie Whalen, Title V Sanitarian.
Lacey Natty, Regional Prevention Coordinator, City of Boston. Leslie Goldstein Walsh, Regional Prevention Director, City of.
Danielle Larrabee, Administrative Assistant.
David Tucker, youth development coordinator.
Thank you all. First item on the agenda is public oral communication. That's an opportunity for anyone in the public wishing to speak on an item that is not on the agenda. Have an opportunity to do so now.
There's no one on.
Seeing no one. Next item on the agenda is the approval of the May 2nd meeting minutes.
We accept the May 2nd meeting minutes.
Second by Aaron. Any discussion, edits, amendments? I move that we accept the minutes as written for May 2nd, 2024. Marco?
Marco, yes.
Yes.
Joe Rosa, yes.
Eric, yes.
All right. The next item is the approval of the May 15th special meeting minutes.
Move we accept the May 15th, 24 special meeting minutes. I was not here for that.
Any discussion, changes, edits? Marco?
I was actually not here for that one. I don't think.
Ah. Okay, that's all right. Aaron?
Yes.
Joe Rosa, yes.
Eric Kaplan, yes.
All right. So the next item on the agenda is a briefing for the board on the Sugar Magnolias plans.
I'm going to take that one if I may. So if you all recall, Sugar Magnolias had approached us during our last Board of Health meeting to talk about putting a trailer that would serve as a restaurant in the Cape Ann campgrounds, and much discussion ensued, as you saw in the meeting minutes. And in the end, the applicant withdrew their application with the intent to refine the ask and come back to us. And so I just wanted to update you on how that all unfolded. They sent us a great deal of documentation. We had a lot of meetings back and forth with them during this time period since our last meeting. And they had sent us communications that basically said they would remove enough campsites to provide 1,170 gallons per day of available flow, which was the issue that we were looking for, which accommodated, of course, the baseline of 1,000 gallons per day. That is the minimum for a food establishment, which allowed them, basically ensured that they had no change in flow to the existing tight tank. After, they further said that they would plumb into the existing tight tank. If you remember, we wanted to hard plummet infrastructure, which would also qualify as no new construction, pending proper plumbing permits. They also decided to refurbish the masonry structure to enable their dry goods storage. That would be compliant with 105 CMR 590, which is the 2015 federal food codes. Again, getting the proper building permits to do so. Leveraging the existing campsite bathrooms for staff, which would enable them to have hot water to wash their hands. The building department felt that it would be appropriate to allow them to take a golf cart for employees to be able to quickly get to the bathroom and back. So although it was greater than the distance that's typical, the building department felt comfortable granting them that right. And then they had provided us with a full kitchen design that Gabby spent a lot of time going back and forth with the architect, which is compliant to, again, 105 CMR 590. And so what we decided in looking at all that and conferring together was that they no longer required a Board of Health variance because they were meeting all the terms and there was nothing really out of the ordinary that we as agents of the board could grant. So that was, what we considered to be great news. What we did ask them for was a campground layout plan that showed that the tight tank that they'll use and all of the systems that they're going to take offline and sort of cap. That plan, would, ensure that we would have those 1170 protected. We further asked them for a contract between the property owner, of course, Cape Ann Campgrounds, and themselves that would make clear that commitment. That would also, say that they would be refurbishing the masonry structure to food code standards, that they could show us pump out contracts that demonstrated that they could keep up with whatever flow that was being demonstrated. And they would then apply for a permit application for a food establishment versus a mobile food truck, which they had originally applied for. And that they would meet all required and updated building and plumbing permits that were necessary. What was important that was not sitting in the remit of the health department, but the building department, upon close review of all that they had talked about, realized that they were trying to operate a business in a residential zone. And so they made clear to the applicant that they had to go before the zoning board of appeals and ask for a variance to be able to have a business. We further, after sending sort of this clarifying communication to them saying, with all these terms, we don't think you need to go before the board. We had a call from their kitchen architect who said that they're not able to show us what that tight tank and those 13 sites that they would take offline. Because what they had planned to do is just to take off 13 sites throughout the campground, of course, attaching to different tight tanks. So we explained to them that would not, satisfy the need. They did have their plumber send us a note that said that they estimated that they would only burn, I believe, around 190 gallons per day versus the 1,000 that is sort of the standard. And what we had advised them is that the document that we got, which was simply a statement, no rationale, no calculation, that to come before you to ask for that variance, because now they would be back in a variance land, right? Where they would be saying, it's not 1,000, it's going to be less. We need you to approve this. And they, they, in the end, because of all of these factors, have decided to withdraw the petition to both have the restaurant there as well as go through any zoning appeals. That's sort of what we have from them verbally. We don't have that in writing. But we had the applicant come in and personally tell the health department in no uncertain terms that they were withdrawing. And then also sort of head down to the building department and say the same thing to our building commissioner. So where we stand right now is the belief that they're not going to pursue this. We stand ready to support them if they decide to, provide the documentation that they need to, really help us understand the gallon per day estimates that would allow them to have a smaller number of, RVs offline. But at this point, we believe that they've withdrawn the petition to have the operation.
Yeah, that's unfortunate, but kudos to both Melissa for responding to our needs as required. But also the department has bent over backwards. That's kudos to you guys for trying to make this happen. Too bad. Any other comments or questions on this issue?
I think it's important to call out that we made the building department and the health department as well in guiding her on the need to have a mobile permit. That was a mistake by our former team members, and the building department sort of advising her that a zoning requirement would not be needed was also a mistake. And so it's unfortunate that Melissa was sort of led to believe these certain things and had to uncover this as she went. So we feel very badly about that.
That's a very good point, actually. Something I was going to say, but forgot. in that perhaps this is an instigation to promote something in the city, more cooperation in the city. I don't know what shape that would take, but as these things come forward, perhaps there's an ombudsman of some kind that could be charged with coordinating all the interactions that are likely to be needed from department to department. That would go a long ways, I think, to minimizing these kinds of after the fact, oh, but you need this too,
Right.
kind of comments.
Both that's Department Ombudsman, but then also within our technology itself, when we're talking about permits, we can sort of make clear to our applicants what the expectations are. I think there's great room for improvement there.
Yeah, it might be useful to find out. I can't imagine that this problem is unique to Gloucester. So it might well be worth trying to find out how other communities coordinate these kinds of things. Yeah. You're up again, Dominique,
Right.
for,
So in this month of May, we were doing a lot, from, across the entire department. And I just want to call out that there wasn't a single team member in the health department that has not been working just as hard as they possibly can to get everything done. And you're going to hear from all of them in a minute. But, overall, the things that sat on my desk this month, as I'm overseeing the Gloucester Dialogues Research Project, which is an ARPA-funded needs assessment that's designed to understand the change in our community post-COVID. So how have the needs of our residents changed? And during the month of May, we've met with over 36 community organizations, exploring needs, opportunities, post-COVID impact, and that also includes department team members. So as an example, Cindy joined us to provide public health nursing perspective. Chelsea joined and Lacey as well joined us to talk about the, prevention and substance abuse perspectives. And the community organizations came in teams of 5 to 7. Their leaders that they designated would be the best to speak about the needs of the residents. And we went through a series of conversations that were, collaborative across the table, facilitated by another firm outside of our department so that we could remain agnostic and really listen very carefully to them. So that work and that research will all now be combined with over 18 data sources that we've collected from local, state, and federal resources. And it'll be pulled together to provide a perspective on where the health department can apply its attention, beyond where we are today. Because as you know, on the health services side, we are wholly grant funded, and it's primarily in the area of youth prevention. So obviously there's a lot, and the Council on Aging, a small grant that's ending in its last stages of ending. And so this is designed to help us understand how we can focus our efforts, what grants we might want to go for, what role we can carry in the city to be supportive of our community organizations. And that project's going to wrap up in August. We'll be involving, giving you all readouts on that as they're presentable. Right now, it's very raw. And I encourage any of you that are interested, if you'd like to hear more about it, I'm happy to share sort of progress and what we've done so far. We're also working on emergency preparedness. So there's been a few days sessions that we've been attending, working on our current documentation, looking what we have as it relates to our ability as a department to respond to moments where we either as a leader, mass vaccination, perhaps even mass sheltering, but also places where we'll work with the emergency management director, Bob Rivas, and his staff to be a part of a coordinated effort. So those efforts are very complicated and long. Our documents haven't been updated since I think 2011. And so it's time to sort of bring them to life and have them be practical and ready to respond. So that's been a lot of work as well. We delivered our budget to City Council and other news, and we're happy to say that the mayor's recommendation, which was smaller than what we thought we needed, of course, because this is a very tough year for the city. But at least from a budget and finance committee standpoint, they moved forward with approving the majority of our funding. So we're pleased about that and hopeful that we'll move all the way through City Council approval. We also, as you know, Jake left, hired a food inspector. That process was exacting. Gabby brings a lot of expertise to the game and created a nice case study that all the applicants worked through, and she'll probably talk more about that and let you know how that all ended, which was successful. I think I'm very excited about that. And then we continue to work across the team to support delegation and improve service improvement. It's difficult, as you'll hear. We've been doing a lot of, triaging in the moment because of the pace of things that are hitting us, but we are very focused on how do we delegate, how do we keep the subject matter experts focusing on things where they can make a difference, and help delegate to Danielle, to Catherine, and to the computer as much as possible, the work that isn't sort of worthy of their thought. It's really important because there's a nonstop flood of need, and Sugar Magnolias is one example of triage moments. There are others that applicants in the process across different permitting that are very complex, and I'll be very honest with you, people are not so happy right now with sort of how we're able to keep pace with their expectation for turnaround. So we know it's important to be able to get things off our plate and delegate and have as much automation as possible. But meanwhile, we're also still sort of, trying to do that and handle these very complex applications that are coming before the city right now. But again, just want to give a shout out to 100% of this team because they've just been working really hard on that. And so I'll stop there. I don't want to steal Gabby's thunder.
And now you're like a page reference, it's page 17, agenda item 6. In keeping with some of those applications, I currently am working on 8 different food service applicants throughout the city. So there's a robust need for new food operators coming through. As you know, Missy withdrew her trailer application, but she still has on the table her 18 Rogers Street full service restaurant. I was hoping to open 51, which is 51 Rocky Neck. They ran into some building troubles today, so that is delayed. But we have, I think, 6 other applicants who are going through the process, and we hope to be working with them shortly as they do their build out, bringing them to fruition and online food service. So that will be very exciting once we get there. Right now, I didn't create a chart for this, but we've been issuing many mobile food truck and temporary food permits for all the events coming up. We're preparing for some very big Fiesta and some other big events. So that's fantastic. But I did want to just point out that we went through a very robust interview process with, I believe we started with 8 candidates, really amazing people. If we could have said yes to all of them, we really would have. But we did come up with a final applicant we were very impressed with. Sophia, is it Reyes?
Reyes, I believe.
Reyes, who will be joining us on Monday.
Yeah,
So
excellent.
very, very excited to have her on board, and she'll be at the next board meeting. You guys can all meet her.
Gabby, can I give them just a quick overview of her skills?
Oh, okay, sorry. Yes.
So 13 years in food service, also experiences around that, holding multiple jobs in leadership and operations, and a degree in public health from UMass Amherst. So we're pretty excited about the mix of training and skill sets. We think she's going to be pretty quick on the uptake, and we're excited to have her join us.
Where did she come from?
Gloucester.
But she was working in Gloucester, or?
Oh, yes, she was working for, I believe, a landscape company, but doing
As
some
head of operations.
operations
Yeah.
management.
But
Yeah.
she's literally been holding multiple jobs.
Yeah.
And they're all really in keeping with where we want to go from an automation standpoint, from an operation
Yeah.
management standpoint, and then of course the food service
She
expertise.
loves multitasking.
She loves it, right?
So
Which is
we're
sort of
very
a
excited.
She better-
cultural must have, yeah.
Who's next?
All right, it's all been a blur. Last couple weeks, especially in May, everyone trying to get their pools open for Memorial Day weekend. That was a big week of everyone scheduling last minute. But better news, beach season has begun. Yay. So weekly testing began May 20th. Gabby has been going into the water each week while I take down all of the information on our field data form, and everything's been so far so good. We did have a bit of heavy rain, right, just 2 weeks now, 2 weeks ago. So as Dominique had mentioned, the last board meeting, we were gonna be doing and following new protocol. And closing the creek due to an assumption of bacterial exceedance after rainfall or storm. So that happened on May 28th. And we retested on the 29th, and it was all good. So it was reopened by May 30th.
So that scheme seems to be working.
Mm-hmm.
It's a European word scheme. In the US, it's not such, it doesn't have the same connotation that calculated strategies that.
So yeah, where if we had tested and it came back high, we could have been looking at multiple days of
Sure.
closure over just really 1.5 days. Yeah.
And shout out to Danielle for really supporting social media education and making sure that communications are out there pretty quickly. Both with our city administration as well as with our constituents.
Yeah, that's especially important in this issue.
Mm-hmm.
I just had a follow-up question from last month's meeting, the housing situation that had transpired. Did that all?
Yes,
Go
so,
as planned?
yes, they have moved to the 3rd floor unit. There's a little bit of a hiccup going on with that, that is requiring a little more from the building department side of things on the second egress. She's gonna have to do some work. It's a very old house, and the second egress is literally a hatch in the floor that doesn't qualify as a true second egress. So there are stairs that go down, but it's not legal. So she is working with the building department to figure out what needs to be done to get a true.
Are the people in
Second.
the
But
apartment?
they are in the new, yes, unit, so better situation than what they were in, but they're still, it's not quite closed out yet.
Leslie Whalen, Title V sanitarian, pages 20 and 21 on the report. And just to highlight a few things. Those of you on the septic subcommittee have already heard this, but for the rest of the board, I wanted to let you know that one of the 3 Beechcroft Road sewer connections have been completed. And when I was there I think it was about 3 weeks ago now, I was told that it would be probably 2 weeks till the next one is done. So it takes a while to do all of the different parts, getting the plumber, getting the electrician, scheduling. I haven't been called out for the second one yet, so it takes time. And then a couple other things. 50 Hilltop Road, that was the septic system that we had asked for water well samples to be collected, and 2 of the 3 neighbors have requested that we collect the samples, and we did that on Monday. The bacteria results have come back negative, which is what we want to see, and it'll be at least another week at the ammonia and nitrate results back. Very low to nothing.
That should make those people happy. If they've never done that before, it's something that the public should be aware of and something that people should do if they're drinking out of well water. You should do that.
One other thing I'd like to mention, Concord Street, there's a development proposed intersection of Concord and Bray. And we reviewed plans about a year ago and had 4 comments. And it took them about a year to get the revised plans back to us. Maybe not quite a year, nearly a year. And we have them and they're under review by our consultant, Isaac Giroux.
On that note, there's heavy neighborhood interest and applicant interest in sort of like our process and our approach. So Leslie has documented all of the communications between the applicant and the city. And we'll be sharing that with the applicants for their understanding, and then also with the neighborhood who wants to stay very close to this. And so we're almost done assembling. It's a lot of communications back and forth, and we want to be sure we're accurate. So we hope to be able to have that prepared by end of this week, beginning of next, and be able to meet with the neighborhoods who'd like to talk with us about how we're approaching oversight of that, which, happy to do that. And then also to be able to guide the applicant with ongoing counsel and how they can be successful through the application process. We have a similar dynamic going on at 187 Atlantic as well. I don't know if you want to talk about that one quickly.
Sure.
These are both sizable subdivision proposals.
Right. That's the one, drive to Winkersheek Beach and you see all of the trees that have been taken down. 187 Atlantic Street. The Weston and Sampson, who we outsourced the review of their water quality assessment plan, that was conducted, and we had a meeting with our engineer and their engineer, and they are now on the same page to go to the next step. Basically, all they gave us was something very preliminary. And they wanted to make sure they didn't go drilling wells into the wrong places. So they have an understanding now of what we need.
Bree, you didn't mention the interns. I don't know if you want to
Oh,
do that.
yes.
Yeah, I think it's.
I did
I was
forget.
thinking that correlates to our ability to have command and control over audience.
So true. I spent a lot of time with them today. Big important piece of the summer. Yes, we have 3 summer interns. 2 through the Department of Public Health's local internship program. One is Alan. He is currently studying, doing his MPH at Yale. So he is working on a big septic project here with Catherine and Leslie, and getting all the pump records in one place, and a lot of process data analysis, all the good stuff. So that's gonna be his big project for the summer. We have Ryan, who's a local, he lives in Beverly. He's currently studying, he just finished up his first year of undergrad at George Washington University studying public health. So he is working on the rental certificate regulation, diving into seeing what other communities are doing, kind of comparing it to ours, doing a deep dive into trying to find out how many rentals are in Gloucester, comparing them to what we have on file for who has certificates, and then seeing like compliance with state sanitary code like violations, and seeing if comparing if those people have had pre-rental inspections or not conducted. So also a very meaty project for the summer. And he dove right in today. Today was his first day starting, and he already had a big PowerPoint presentation going. So yeah, it was very interesting. And then we have Neha, who is studying at Lehigh, Dominique's
My alma mater.
alma mater. And she lives in Westboro, so she will be remote. But she did drive up today to meet everyone, which was she had a great time, and is working on a big data project with the community needs assessment.
Yeah, with the Dialogues project.
Mhm.
I just want to call out the first intern, Alan, doing his research on wells and research on pump outs. That's going to allow us to have a perspective on how we can better build, oversight of compliance to pump out protocols, right? So You know, if you have a septic system, are you pumping it out with the regularity that you should be? If you are, if you have a well, you know, where are the wells? So just we have you know, an updated and clear picture of that dynamic. And then from the apartment side, you know, we want to know who are the apartment owners and how other towns are doing it. And we're hoping to be able to build a service that is a benefit to apartment owners. You know, we've heard that they sort of pay their fee and then they, you know, we make them spend more money. And so they're not necessarily seeing benefit from us. Our job, of course, is to protect people, but it's also to be a service to residents. And so we're trying to use this indenture project to get a sense of how we can shape a service that will both help enforce and create safe environments for tenants, but at the same time, understand what the apartment owners need so that we can help them be successful in that same effort.
Good. Who's next? Cindy?
Next agenda item 7, which is page 22 through 28. This past month of May, 58.1% of our state reported infectious disease cases were respiratory illnesses, but 39.5% of them were COVID. We do have a new strain of COVID that's circulating. We are not seeing the high hospitalization and death that we saw in the past because people are immune. We have much stronger immune systems because of vaccinations, and the population is better able to fight off these infections and not be as severely ill. I noticed that I left out my human granulocytic anaplasmosis case that did eventually get revoked, but it was investigated and closed. Gloucester does still have a higher COVID-19 case rate, just a little bit higher than the state average, and our percent positivity rate's a little bit higher, and our vaccination rate's higher. Good thing. We are no longer able to get right now the state or the county information. So I got COVID-19 national and regional comparisons. So nationwide, the COVID-19 wastewater concentrations are now about 278 copies per milliliter. And in the Northeast, they're currently 377 copies per milliliter. So it's not really that much higher than the national average.
Gloucester is not that much higher, is that correct?
The whole Northeast,
Okay.
yes. And then there's like a little
So what's
demonstration.
going on with the state? Why don't we have their data?
So it's BioBot. It's changed the way that it is, the way that they're putting out their data right now. So it's just not the same. And I don't know, I've worked with it as best I can. Tick-borne illness, there is a table here that shows the number and the rate of ED visits by patients who are diagnosed with tick-borne illnesses. You'll see Essex County there. It's 1.06 per 10,000 visits, tick-borne illness. So also, our Narcan distribution last month, I gave out 65 kits. I also got 145 shipped to me. So right now we have 119. I am working with the Housing Authority to get, and I will be doing that not next week. We were supposed to do it next week, get them into the buildings, all the public housing buildings, but it's going to be put off until 6/18 because the person who's working with me is not available that day. I did send out 8 postcards to new moms last month, and I did have 1 visit, which was very successful. I also held the diaper drive in the first 3 weeks of May, along with our community partners, Shaw's, Eastern Avenue, Stop and Shop, KPN YMCA, City Hall, and City Hall Annex. And through these sites, we collected 1,391 diapers, 922 diaper wipes, 2 diaper creams, 6 baby washes, and 2 big containers of Enfamil, which when I was in Stop and Shop, noticed that they cost $56 each. And I'm like, wow, that's too expensive. So, and someone from Open Door picked up my donation bin at Stop and Shop the day before I was to pick it up. So I really don't know. We had more diapers, but we'll never know exactly what it was. Last month, we also, I did one Shingrix administration during the month. And there's our inventory of vaccine, which is very low at this point. I don't think we give out much during the summer. During the month of June, I will be conducting the immunization and physical checks for camp staff and campers. And we also held a meeting last month with all the stakeholders from Cape Ann or Gloucester regarding immunizations for new immigrants and new people coming into town. The school
General students.
Yeah, in general,
Yeah.
kids. The school department and Pathways noted that over the past year or two, they've had trouble with people getting all of their immunizations in a timely manner and finding a medical home. So we had a very well-attended meeting, and the whole goal of this meeting was to come up with a plan to make sure that people can be vaccinated in a timely manner, and that they can have a medical home. So we had really good participation. Dr. Orr was not able to join us, but I found today, after I talked to his office, he is only working 2 days a week now, and he's got, so I think he's scaling down a little bit. Concern that we don't have a lot of
Which was one of the
CPs.
topics was access, yeah.
Yeah, access to care. So we're working on a document that the school department and Pathways will be able to use to give out to people, telling them where they can go to get, to sign up for Mass Health, have assistance doing that, where they can get their immunizations. Cape Ann PD has offered to take anyone as long as they register within 24 hours and vaccinate those children. So that's what, that was I feel like it was a worthwhile meeting. And we
Yeah,
will
it's
have
great.
a document come out of it that will be helpful for the community to use, and the schools and daycare centers, et cetera.
Yeah, so we had people signing up for education programs on vaccinations. We had the various community organizations learning about services that they each
Mhm.
provided and when they were available, which folks didn't know about prior to that meeting. We had a wholehearted full court press
Yeah.
helping the public health nurse or the school nurse for Gloucester Public Schools figure out how to get everybody vaccinated appropriately. Particularly seniors for meningitis. I think we talked a little bit about that last time. It was really, and kudos to Cindy again for coordinating that, reaching out to every single party and getting them all in the room at the same time. It was not an easy feat.
Mhm.
And so it's really pleasure to be a part of that room, part of that meeting.
And the hospital participated, the
Yeah.
community health center. So it was good because there's been a lack of communication among all the partners. So
Yeah, misunderstandings.
Yeah, yeah.
Cindy, can you talk just a bit about avian flu? I noticed that you
Oh,
have
yeah.
about 350 exposed farm
I
workers.
do.
That's quite
I
a bit
do.
of growth from last.
So, today I went on and I got the update today from the CDC, the situational, summary. We've only had person cases, 3 in the United States, 1 in Texas and 2 in Michigan. And we're still telling people not to, here's information that they're saying is, protective actions for people. Avoid direct contact with wild birds, observe them from a distance. Avoid contact with any dead or ill birds. Call the Department of Public Health immediately and they will come and pick them up. Avoid unprotected direct contact with or close exposure with cows and materials potentially infected by cows that are confirmed to have avian flu. People should only be consuming pasteurized milk, pasteurized cheeses.
Just a word on that. There's a very recent study that for an infected cow, the milk especially is just chock-a-block.
Yeah,
with
full.
Live virus.
Mhm.
Yep.
So please,
That's why
no one.
the raw milk
drink
is so.
Raw milk.
and that is safe to eat properly handled and cooked poultry in the United States. The other thing is that right now we do not have any, the CDC does not currently recommend any travel restrictions related to bird flus in other countries either. So,
They are watching it closely and
very closely.
giving pretty significant briefings
Yep.
and, you know, what's going in terms of volumes and things we need to know.
And the CDC is also, and MDPH are encouraging an increase in testing and typing over the summer months when influenza testing is usually not routine, so that we can track the avian flu.
And so what that means is that if you have the flu and you go to the doctor and they say, oh, you probably have the flu, push to be tested because they need the data to know where H5N1 is moving to. So they really want folks to be testing for the flu. Okay, great.
Question about the vaccine clinics. I know you guys do like flu ones in the winter and stuff
Yeah.
like that. Is the health department in partnership with like the school nurses, is there ability to do like vaccine clinics within the school?
I've worked with the schools, annually. I go in the schools and I do like COVID clinics and vaccine clinics for, influenza. I have not gone in because we have to get permission from these parents. I feel like with some of these people that the parents need to be there to get multiple, vaccines. We talked about that during our meeting. We talked about, getting like a mobile vaccine clinic, and I can do that through the state. One of our partners who was unable to attend the meeting was the regional immunization nurse from the state of Massachusetts. And she said that she would work with us as well. So we're looking to coordinate with the school department and the state to maybe get someone down here. If having the people go to Dr. Stockman doesn't work out
And
well.
I think if I can add to that, what came out in that session is that it's very important that those vaccination moments are also checkup moments
Yeah,
and check-in
exactly.
moments. And so the pediatricians are really concerned about losing that contact point because they do a lot more than, you know, shot an arm.
Exactly.
Wellness checks, mental wellness checks. And so they really feel it important that they not lose that. So that's when the conversation went to the access issue and the
Right.
time frame to get it, communication issues, language barriers. But they are exploring, you know, how the clinic, in the high school as an example could be helpful. And the like. So it's what was really great about that meeting was that everybody in the room was so vested in problem solving around how to sort of make this go away as a challenge. Because vaccinations are free.
Mm-hmm.
There should not be the barriers that there are. Travel became a barrier, you know, can people get there? When can they get there? How can they schedule? Just a lot of things that you don't understand in everyday actions, that these are things that are just completely stopping access to appropriate vaccinations.
So the medical home is, to me, I've always thought that the medical home is very important anyway, to establish a relationship. We also talked about that some of these kids, if they are not vaccinated in the state of Massachusetts, maybe we don't have that information in MIIS, which is the online, everyone's, information. So some kids may have more vaccines than we know, than you know.
We also talked about sharing that data
Right.
among the right parties, the HIPAA covered entities. And again, kudos to Cindy organizing and now following up on all the actions promised, making all that unfold. It's really, really valuable service.
We're also looking at lead levels right now. So I reached out to all of the pediatricians and seeing what they have noted in the past few years regarding children and lead levels above the accepted levels in Gloucester, and if they're follow through with parents for getting like second venous draws. Follow through, taking care of those kids. As a matter of fact, the person that answered the phone at Dr. Orr's office said that there's a kid with a level of 29 and they're trying to chase these people down and they're not
It
responding.
shouldn't exceed 5.
No,
As an example.
should not exceed.
And now the state's saying 3, right?
Yes,
They're trying to-
3.5.
Yeah.
He's saying 3.5. Yeah, that's frightening.
So on that happy note.
That's me. I know.
Save the best for last.
Is there a way you can scoot up here so that the people on screen can see you if they see
Yeah.
this as a recorded meeting?
Over. Hi. Chelsea Goldstein Walsh, Regional Prevention Director for the Health Department. I'm actually here with two of my team members, Lacey Natty and David Tucker. Dan Lieber is also a part of our team, so very excited to say that we are fully staffed, which is wonderful. And Lacey, I know you introduced yourself in the beginning of the meeting, but if you want to just give a
Yeah.
little bit of an introduction, that would be great.
Yeah, so I'm born and raised in Gloucester, went to Gloucester High School. I graduated from Mass College of Pharmacy and Health Sciences University with a degree in health sciences. Loved my concentration in public health courses. About 15 years in health and human services. Spent a long time working with Erin at Action in their Housing First program. And then most recently, I was the program manager at One Stop Harm Reduction Center, which is the syringe exchange in town. And now I'm on the team here and I love it.
This is Lacey's 1 month anniversary to this day. It started May 6th. We're very excited to have her on our team. I'll give on staffing, we also have 2 interns working with us this summer. One is a college student who's studying psychology at Mount Holyoke College, Morgan Riley, who's, I think, is she a Rockport resident? Rockport resident. She has not started her internship yet, but she'll be working with us over the summer while she's home for the summer from college. We also have a high school student who is a current sophomore at Gloucester High School, who's on our Gloucester Youth Leadership Council, who will be working closely with David over the summer to do some social media campaigns and just maybe do a little bit of planning for our youth work for the upcoming school year. He also has not officially started in his role since high school is not done yet. Couple of recent events that we attended and or facilitated. We attended the Senior Safety Day, senior in high school, not senior citizen. I know we're in the senior center. High School Senior Safety Day on Monday, May 20th, which is for all Gloucester High School seniors regarding safe driving practices and really the importance of not driving under the influence. We know that rates of impaired driving accidents go up around prom and graduation season. So this was organized by the school, but we were invited to attend. We provided pizza and ice cream, and we had a resource table there with lots of local resources and opportunities for us to interact with the teens. So that was great. And we're really grateful to the school department for allowing us to participate. We also had our very last teen mental health first aid session this morning. So students, the sophomore class has completed the teen mental health first aid program. Yay, they're certified as teen mental health first aiders. It's the first time we've done it, and we're hoping to continue this and make it an annual program that's just incorporated into the school. We'll be having a pizza party for them next Tuesday as a thank you. Couple upcoming events. I actually brought flyers. Want to pass them around. We have a huge event coming up this Saturday that we've been working, David in particular has been working really hard on, our teen summer send-off. It's this Saturday, June 8th from 12 to 4 at the Rockport Teen Center. And it's being planned by high school students for high school students. It's completely free and it's for high schoolers from across the North Shore, not just Gloucester and Rockport. You are all invited as well to come stop by and smash a plate and grab some tacos. David, do you want to add anything about the event?
Yeah, we'd love volunteers if anybody's interested. A good amount of you have already offered your time. Kind of silly tasks like welcome table, checking on vendors, running table games, or even just hanging out inside the teen center with youth to be a trusted adult. Pretty awesome. What was the last year? About 60 youth joined, and currently we're at 155 from me going to the schools and kind of talking to youth and going to tables and pitching them the awesome event. Kids are normally used to us coming to them with like, this is why we're doing this event. This event is kind of just to have fun and show them they can have fun without kind of using substances and having access to resources. During the summer, it's so hard for youth because they don't have their coaches anymore. They don't have their guidance counselors. They don't have their teachers. So this event is a way for them to get resources throughout the entire summer. Yeah, it's pretty awesome. Fun stuff. Got the taco truck, whoopie pie wagon, smashing plates, as you said. And a previous middle school teacher, Austin Souza, who also used to work for the Y, and is well known with youth, will be DJing, which is even funnier. Yeah, awesome event.
Weather should be good.
We're
Yes.
so grateful. Last year it poured. It poured. And they were calling for rain, but it's looking good. And they were calling for rain like even like a few days ago, so.
Everybody's crossing their fingers.
We actually have a huge tent though this year. We learned our lesson. So
Yes.
if it does rain or if it's really hot, there'll be shade. So spread the word. We're very excited. And please feel free to volunteer, just stop by and say hi. At that event, actually, this ties nicely into some of our ongoing campaigns that we're doing, our ongoing initiatives. So at that event, we'll have Dave Thompson, who's the director of the Danvers Cares Coalition and has his own communications firm. He and his staff will be there to interview students who attend with signed consent and if they would like, to ask them about the qualities that they look for in a trusted adult. And to ask them to, if they choose, to nominate a trusted adult that they have in their lives. And we're going to create a series of these videos that can be shown on social media and small clips, and then also can be woven into a larger video that will be hosted on our website. That will be phase one of our project. We then intend to seek out the trusted adults that were identified and invite them to be interviewed as well about their role in the community as a trusted adult for young people. And we're again aiming to weave that into a video series. So we're very excited. We're offering quickly, I'm almost done, I swear. In the spirit of like really honoring and promoting the importance of trusted adults in young people's lives, we're offering some training. So for folks who want to beef up their skills a little bit, for folks who work with young people, we'll be offering a youth mental health first aid training this month. On Thursday, June 20th and Friday, June 21st, from 8:30 to 12:30 p.m. at the Cape Ann YMCA. It's an 8-hour training being offered in 2 4-hour blocks, and that is completely free for anybody who would like to attend. Let me know. I'm happy to send you the registration link. Once you attend that training, you are officially certified as a mental health first aider, which means that you've learned how to spot the signs and symptoms of a young person who may be struggling with a mental health challenge and built up your skills on how to approach that young person and express your concern and get them the support that they deserve. So it doesn't train you on how to be a therapist, but it does train you on how to recognize signs and how to have the confidence to have those conversations and hopefully connect that young person to either a therapist or whatever type of support they need. We're excited about that and hope to continue to offer those trainings on a semi-regular basis moving forward. Lastly, just some ongoing projects. We continue to promote SAMHSA's Talk They Hear You messaging around the importance of talking to your child about substances and having open conversations.
And again, SAMHSA, you can just,
I'm sorry, Substance Abuse and Mental Health Services Administration.
the state.
It's federal, actually, federal. So it's a prepackaged campaign and they have all these materials. Right now, we've just been using their social media posts, but we're looking to even get a billboard and put some ads on the sides of CATA buses, not ads, but like messages. And then lastly, we are looking to implement a survey across the 7 communities in our regional network to survey parents of current 6th grade students about what was helpful and what was challenging and kind of just their experiences with the transition from elementary to middle school. And we're hoping to use that information to support future parents who have kids who are getting to that middle school age. So we're just trying to get that survey out right now for the end of school. And we're excited to see what the data shows. That is it. Did I miss anything, Lacey or David, that you want to add?
Let's talk about after prom.
Prom was huge.
You want to talk about after prom?
Yeah, I can touch on this prom. So Officer Scola and me have been continuously working on awesome events, and one of the events that he has been working on for years is the after prom event, which is an amazing idea, and I wish was around when I was in high school. So currently they have a taco truck that we're having at Teen Summer Send-Off. Started again. It's a good truck, and the guy who owns it very community oriented. So he's great to get for youth events. And the crepe, I forget the name of the crepe place, but they're pretty awesome too. But they had the taco truck and the crepe place outside of Gloucester High School after prom. So all Gloucester High School students are required to either A, take a limo, or B, take the school bus. It's a nice chartered bus, but they are all mandated to take it. That way nobody is driving to prom. And so Officer Scola set up these two food tables, and as the kids got off, they had a chance to stay for a while, hang out, and talk with either their teachers or even me and Chelsea. We were ready to go with some flyers for events that are coming up, and got to talk to the kids about safe choices throughout the night. Now, kids didn't stick around for forever, but it was a chance for kids to be able to get some food before they either went home. And also was great to be able to talk to them about like safe choices. And I am unaware of how it went afterwards, but from Scola's mouth, the past 2 years of doing the event, there were no DUIs handed out on the night of prom, which is awesome. And I would love to hear what the outcome of this night was, but we haven't been able to chat yet. So yeah, pretty great stuff. And would definitely love to collaborate more in the future on it. Make it kind of like a good party, like the Teen Summer Send-Off. I mean,
Some like games or
yeah,
Something.
cornhole, can jam, field house.
idea.
I remember years ago, and this is, I don't know, a long time ago, when Kim Norman was on the school committee, she had the YMCA, and the kids went to the Y, and it was like an all-night event there. That they were able to use all of the facilities the whole night, and kids safe there.
When I first started, Chelsea told me about an event like that. Or I think it was your high school.
In the community I used to work in Medfield,
Yeah.
all night grad party.
And I was in love with it, and I would love that type of event. I would hate the sleepover part.
Yeah, I
Maybe
know.
we
Yeah,
end at
it's
12 o'clock. I personally hate any event that you stay throughout the night if
Yeah.
you're not awake the whole time.
I think
But-
the kids, I think they wanted them to stay awake.
Yeah. Very hard, very hard. I used to do rockathons and that was hard. But yeah, if we can make it an event that lasts till maybe midnight, they got there at 10:30, get it to go to midnight, maybe have a band and other additional events for the kids to do, I think it'd be huge. But again, it is totally Scola's cup of tea, same as senior day. We are just there to emphasize how awesome it is.
They're at 10:30 to 11:30 on Friday night.
That was awesome.
Yippee.
The kids were all, they were all looking dapper.
Yeah, they
Miss
look
Alves
great.
was looking dapper. Everybody was all dressed up to the nines. Yeah.
And apparently the staff, like high school staff reported that it was like one of the best proms and all the kids were really well behaved and like everyone was dancing and like genuinely having fun. And so it sounded like it was really, really nice.
And they do prom royalty now.
Oh,
Like
I know,
a good
yeah.
amount of people get prom royalty, which I thought was amazing.
Yeah.
Instead
Not like prom.
instead of a prom king and queen, you get prom royalty. So I think there was 3. No, I think there was 6 like prom royalty.
Yeah, there were a lot of people in the sashes. Yeah, it was nice. It was nice. It was cute. That's what we got.
Yeah, all right. Next item on the agenda, I believe, is turn to the board. Anything?
With the new hire that Gabby mentioned, will you guys be completely staffed up at that point?
We will be fully staffed up and hopefully with the city council, knock wood, vote, we will have an additional headcount to add to the septic. This is that position. So we're we're very excited about having a full team.
Anything else? Motion to adjourn?
So moved.
Second?
Do it. Second.
All in favor?
Marco, yes.
Aye. Wonderful. All right, thank you all.
We have so much stuff going on. I gotta share it.
We got ice cream at senior day.
Oh, yeah, holy cow.
Oh,